bill. In this week's commentary, Jason Rosenbaum looks at the impact that could have on their political careers. And he also talks about the issue of abortion. Abortion opponents want a measure with tough restrictions, but that could shake up the Democratic effort to get a health care bill passed.
The House is typically more predictable by nature, as most members tend to vote along partisan lines. But with a few dozen Democrats crossing over, the bill passed in a squeaker, 220 to 215. It's hard to diminish the accomplishment. Congress has debated expansive health care legislation for decades without much success. And now the U.S. House took one of the biggest steps toward expanding coverage since the advent of Medicaid and Medicare. It could be the defining domestic achievement for President Barack Obama. But the passage of the bill seemed to come at a hefty political cost. For starters, the vote was close because 39 Democrats defected and voted against the bill. It remains to be seen whether mainline Democrats will turn against these lawmakers for not supporting Obama's primary campaign goal. The legislation could also potentially alienate both sides of the always controversial abortion debate. An amendment passed banning funding of abortions for the public option and insurance plans paid for with federal subsidies. While the move enraged abortion rights supporters, it likely prevented the bill from failing. But the biggest reason why Democrats may not make politically meaningful gains from this bill comes from an entirely different subject altogether: the economy. As a general rule, the economy usually trumps all other issues in determining voter behavior. In essence, even if Congress passed the health care bill as it is, Democrats still may lose ground if the economy is still weak. And with the 2010 election cycle only a year away, there aren't many quarters left for the unemployment rate to go down to a politically acceptable level. And that aforementioned scenario is not necessarily a sure thing. The U.S. Senate could produce a completely different bill than what the House passed on Saturday. There could be a grassroots revolt if the final bill doesn't have the public option, or if the bill fails to pass at all. This bill still has a long way to go before it reaches the finish line. But whatever the result, the debate over health care could be a rare example of a major legislative victory sparking short-term political damage. I'm Jason Rosenbaum.
And that's going to do it for this week's Talking Politics. Remember, podcasts of this show and all of our shows are available online at kbia.org. Thanks for listening. I'm Sarah Whitmire.